of the University of Haifa's weekly COVID-19 update with Dr. Manfred, Director of the University of Haifa's International Master's Program in Public Health and Global Health Leadership. Each week, Dr. Green has been joining us to dissect the latest developments around the pandemic. As for this week, it would be hard not to talk about the George Floyd protests that have dominated headlines around the globe, and specifically how this might impact the spread of the virus. So Dr. Green, welcome. We're delighted to have you with us again.
Thank you very much, James. And do you want to start with a question or do you want me to start?
I'll start with a question.
Okay.
It kind of ties perfectly in with the intro.
Okay.
Protests and riots raging through the US this past week, and indeed the world. What implications might this have for the pandemic?
Right. So I'm going to answer that question. I want to just go back very briefly to what I said last week to show you where I think we are and what's happening, because there's an interesting discourse going on, and I think it ties in very much with your question. Remember, I mentioned that there are these so-called 5 stages, which are basically Elizabeth Kubler-Ross's concept of grief and dying, getting to, which is a kind of, sounds dramatic, but you know, where you have the phases which are basically denial that nothing's happening or it's not going to happen. And then you get angry because it's happening, but it shouldn't happen. Then you go into the bargaining. Maybe it's not as bad as they said. Maybe it'll be better. You go through this depression phase when you're kind of upset about it, but that's what it's happening, even though you thought it might go away. And then you get to the acceptance where you live with it. So, and that's basically from Elizabeth Kubler-Ross on death and dying. But it applies also to our kind of situation now. I'll actually I'll leave it on for the moment and you can look at this. Why I say ties in is what is happening and what could be tied into the protests is to say the protests are clearly apparent. To me, it seems legitimate protests. I'm not here to judge the protests. I'm not in the United States, but it certainly seems from where I am that these are very legitimate protests and people are angry. So they're angry about something else now. They're angry not only about Corona, but they're angry about something else that's going on. And they're also very angry, I think, in many ways about what's been happening to their lives. Because they're being restricted, they can't travel, they can't meet friends, all kinds of things are happening which are very uncomfortable in living. So it's a you know, the term perfect storm, it actually goes together with something that's, you're angry about 2 things at the same time almost. So that's a problem. And then what you do have is when you saw the protests is that because you're involved now in something else, it's difficult to follow guidelines. So using masks, social distancing and so on go by the way. And that clearly could be a recipe basically for a very much increased spread of the disease.
Right. So one thing I wanted to touch on as well was the use of tear gas that has been used, we've seen being used across the US as a way to contain groups of protesters. Now with coughing, a known source of spread, how might this also be a factor in any increases in the number of cases?
I think your point is well made, and I think that this is something that I'll lead on to something slightly different as well about coughing, because coughing obviously is the way that we're spreading the germs, coughing and sneezing and speaking and so on. So basically we have to recognize that masks are going to be important, but also I think that part of what's been happening also is to some extent an obsession. And I use the word a little bit too lightly. I wouldn't like to say obsession, but anyway, you know, a certain kind of feeling that if you clean all the time, if you use alcohol to clean, if you use detergents and so on, clean surfaces, that's the way to stop the virus. Well, actually, it's, as you've heard, it's one of the minor, basically, ways. It's good to maintain good hygiene and a bit better hygiene. But that shouldn't really be the main focus. The main focus basically is on social distancing, and masks are a good sim. And I can give you an example. I'll go to the supermarket and see the workers, the people serving you, cleaning their hands, using alcohol, doing this, and not wearing a mask. Well, as you mentioned, where am I going to really get infected is from coughing and sneezing and talking. So I think that that can be something that has to be taken into account, and certainly in situations where people are close to each other, and using things like tear gas will obviously create some issue about coughing and sneezing. So, it all works together to spread the virus.
Right. So, I guess with that in mind, the US has also come under increasing scrutiny for its lack of testing. Do these mass gatherings and everything that's happening right now highlight a necessity to ramp up testing?
I think that testing, again, we need to emphasize the two kinds of testing. Testing for cases, in other words, looking for the antigen for people who actually are likely to spread the disease, and testing serology to see who's already had the disease. Mm-hmm. I think that the testing to see who has the disease makes sense in order to limit the spread of the disease. And again, it'll be essentially because we don't want to overwhelm health services and so on, and also to protect those who are vulnerable. I think that one of the main issues is trying to protect people who are vulnerable. And so obviously the testing and then looking for contacts makes sense, but it has to be seen in the context of what you can do. So I would say that increasing the testing makes a lot of sense, but that again, we have to remember again that we shouldn't reduce the focus on the fact that someone who does not feel well should get out of circulation, should stay at home. That should be the main message. And testing will just confirm whether or not they have, and then obviously maybe take a look at contacts. But I think that we're talking now, I mean, we may talk about it at a later stage, but this whole question of the second wave, and maybe I'll use this just to mention something. People are saying, will there be a second wave? And there's an interesting term now that's being used, a manner of speaking. Some people who say, we don't believe there'll be a second wave. Well, what does it mean, I don't believe there will be? That sounds almost like a religious cult, that I believe in something. Why do you believe or not believe? On what basis? So, is it intuition? Is it what? So again, we really have to, and I would ask the question the other way around. Why shouldn't there be a second wave? Because in fact, that's the way these viruses work. So that's why we'll go back again to this whole issue of testing and how much we can actually control the spread of virus. Because again, I'm not just saying I feel, on the basis of the data we have and the way the virus is behaving and it's spreading, as other respiratory viruses such as influenza and others spread, there's likely to be more and more waves, and probably in the winter, a much larger amount of infection. So we have to recognize that. And that'll be part of the testing issue. Try and protect the vulnerable, and testing will be one of the ways.
Right. So moving on to Israel, and kind of tying into what you just said, I think after many thought, or I should say hoped, that the virus was behind us, we've witnessed a fairly significant spike in, since restrictions were eased. Does that imply that we've made a mistake in opening up too soon, or is this, as you pointed, an anticipated and unavoidable side effect?
So I'm going to use this presentation and take us back to bargaining. I've more or less said initially that, you remember that we spoke about the denial, and we said, you can deny it, but it's here. The virus has come out of China, it's into Italy, it's spreading to Europe, it's come to the United States. There was still some denial. Maybe it won't spread. And then there was anger when it did spread. And we're very much at that level now of the bargaining, of saying, okay, it's gone down. Look at Europe has gone down a lot. Here it's gone down a lot. So maybe it's not going to spread. Maybe we made a mistake. Well, that's just, I would guess, at least I would say, a misinterpretation of the situation. With the lockdown, clearly the virus can't spread. Hong Kong is the example I gave before. During the flu season, end of the flu season in Hong Kong with the lockdown, there was no flu, 0 isolates. So you can do that for a while, but you can't keep doing it. And that's what's happened in Israel. You stop the lockdown, we'll get cases. I don't think that we should go back to lockdown. I think we should recognize that we're going to have cases at a certain level, and we have to just make sure that it doesn't get out of hand, and that, again, I keep saying the same, protect the vulnerable and make sure that the treatment for people who get ill is available and is of the best quality. And the diagnostics are good. That's a third thing. But these are the things that we need to, that's the message to the public. I wouldn't close schools, for example.
Right. Right. I mean, so you've actually answered my next question. It was going to be, are we headed for a second lockdown here in Israel? And I guess your advice there would be no, and to what we're doing.
I'm saying I don't think there should be.
Mm-hmm.
That doesn't mean there won't be.
Right.
I think maybe the decision makers will be afraid of what's going on and the increase in cases. My feeling, at least, it's not just a feeling, my judgment, based again on previous epidemics, on previous outbreaks, is that we need to recognize that we're going to have to live with a certain amount of disease. And the main thing that we'll look at again, and I said, are the vulnerable people, the treatment facilities, and the diagnostic capability. These are the things that we need to focus on. If we see that that's under too much stress, then we'll have to take much more action. But if not, we'll have to recognize that this is something we're going to have to be with for a long time.
Right, right. And look, I think I've just about got enough time for my final question. I guess, reopening over the past few weeks. What lessons, if any, can the US and countries around the world take from its strategy of opening back up?
I think that we need to focus on a few issues. We need to remember to protect the vulnerable, but not to isolate them. And we have to look at ways in which they can still be part of the society. Elderly people who are isolated are going to be injured in the sense that it's a damage to them. And we have to recognize they may not become ill from COVID-19, but there'll be other effects. So, just to give an example, visit your grandmother, but visit her while you're sitting outside and wearing a mask. Don't stop visiting. I think that's not a good recommendation. Protect people who are in old age home. But again, look for creative ways to do that. Make sure that your treatment facilities are excellent so that people feel when you do open up, that you don't feel that you're not going to get the best treatment. And the information I get from the field is that the treatment is improving largely because of the ability of the physicians now to understand the disease better, not because there's a new drug available. That will obviously take us one step further. So I would say, work hard on the medical therapy. That'll be great. And again, the message basically, I think, is that we need to look for ways to get back to some kind of normality. I'll make one quick statement and then a more positive one. That the big pandemic of the plague, there were plague pandemics, the early one and the Justian one in the 6th century, and then the one in the 14th century, which went on, it's hard to believe it, went on for 400 years. I don't think we want to be in that kind of situation where a pandemic continues for that long, and we haven't seen and obviously that was a totally different kind of situation. But we do have to recognize that it'll be with us for quite a long time. So we have to adjust ourselves to living with it at a level which is going to be acceptable and make life carry on under conditions where people will feel secure as best possible. And I think we can do that.
Right. Great. Dr. Green, thank you as always for your time and knowledge. If you have any questions, please do leave them in the comments section of this video or email them to info@asuh.org. As always, for more information on the university's work around the pandemic and to support the university during this time, please find the link included within this post. Thank you very much for tuning in. And of course, please stay safe and updated.
Can I make a quick comment?
Please do, Dr. Green.
We're very excited to say that we have been seeing a very substantial increase in registration for our International Master of Public Health program from all over. And we have students applying from developing countries, and we would really appreciate getting some kind of support for scholarships for these very deserving people. So I know that's a sales plan, but it's an important program, and it's a very good program.
Absolutely.
Thank you.
Absolutely. Thank you, Dr. Green.
Thanks, James.